Hello and welcome, future nurses. Today's case study is crafted just for you to sharpen your clinical judgment for the Next Gen NCLEX RN. We'll walk through a real-life patient scenario to analyze key clinical cues, plan safe interventions, and evaluate outcomes using critical thinking and evidence-based care. So get ready to put your skills to the test. Let's get started. Our patient is a 58-year-old male who presented to the emergency department with severe cramping, abdominal pain, persistent vomiting, a 12-pound unintentional weight loss over 6 weeks, and intermittent dark tarry stools. He weighs about 81.6 kilograms with a BMI of 25.8, no allergies reported. He takes lisinopril 20 milligrams daily, atorvastatin 40 milligrams daily, for hypertension and hyperlipidemia. He is married, accountant, non-smoker. He drinks about 1 to 2 drinks per month, and we're talking about alcohol here. And he has sedentary lifestyle, diet that's high in processed meats. His father was diagnosed with colon cancer at age 54, deceased. Mother with type 2 diabetes. Now, for the physical exam, he appears uncomfortable, fatigued, he's pale. And for the eyes, ears, nose, of course, there's no ecteras here. His conjunctiva are pale. For the lungs, his lung sounds are clear, no wheezing. Heart rhythm is regular, no murmurs. And he has distended abdomen, tender in the lower left quadrant, and tested positive for fecal occult blood test. For the lower extremities, he has full range of motion, no edema. And here we have the nurse's progress note, so I want you to pay attention to the cues that are hidden in the phrases here. So let's take a look into the documentation on day 1 at 7:30 in the morning. It said alert and oriented ×3, reports severe cramping, abdominal pain at 9 out of 10, nausea, 2 episodes of vomiting, dark emesis. Vital signs are the following, with a blood pressure 148/92, heart rate 96, respirations 22, temperature 37.3, oxygen saturation of 95% on room air, with pale skin, warm and dry. Nasogastric tube is inserted, draining 200 ml of dark bilious fluid. We have IV fluids infusing. That's 0.9% normal saline at 125 ml an hour. Receiving morphine 4 milligrams IV. Pain reduced to 6 out of 10. Surgical consult requested for suspected bowel obstruction. At 12 p.m., patient is resting, reports persistent nausea, no further vomiting, with blood pressure 145/90, heart rate 94, respirations 20, temperature 37.4, saturation of 96%, nasogastric tube output 150 ml of bilious fluid. And the bowel sounds are absent. Patient educated on NPO status, awaiting surgical evaluation post colonoscopy confirming sigmoid mass. On day 2 at 6 in the morning, this is post-laparoscopic sigmoidectomy day. So this time he was transferred from post-anesthesia care unit. Stable, he is alert. Blood pressure 142/88, respirations 18, heart rate of 98, temperature 37.2, saturation of 97%. Nasogastric tube removed. He's now receiving hydromorphone via patient-controlled analgesia with a dose of 0.2 milligrams per hour, that's basal, and 0.2 milligrams every 10 minutes as needed. Pain score level of 4 out of 10, and bowel sounds hypoactive. Surgical site clean, no drainage, patient position semi-Fowlers to promote comfort. On day 3 at 8 in the morning, patient reports mild loose stools, 2 episodes. He's got fatigue, slight dizziness when sitting up, with vital signs, blood pressure 140/88, heart rate 100, respirations 18, temperature 37.2, oxygen saturation of 96%. Surgical site is clean, no erythema. IV fluids continued, encouraged rest.
Before moving ahead, I have some exciting news for you. If you are determined to pass the NCLEX within a week or a month, then your best option is to enroll in our complete online NCLEX review crash course right now. This course is a comprehensive all-in-one solution, a guaranteed shortcut, and a proven method to pass. Over the last 5 years, more than 5,000 students have successfully cleared their NCLEX exams using this course with an impressive 99% passing rate. Here's what you'll get: 100-hour animated mini crash course, ideal for those who have limited time and want to pass in just 1 week. 300-hour comprehensive recorded lectures covering 300 high-yield NCLEX topics that the exam loves to test. 5,000 real NCLEX questions, practice with actual past exam questions for better preparation. 15 full-length practice tests, including CAT simulation. Feel confident before your real exam day. Exclusive NCLEX ebook, the ultimate guide you need to pass. 1 year full access. Study anytime, anywhere at your own pace. This is a limited time offer. Enroll now to grab 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. All right, now let's dive into the topic.
Now let's look into the laboratory results for day 1, day 3. So I want you to pay attention to the significance here. As far as the hemoglobin, it's 10.9 on day 1, 10.5 on day 3. Hematocrit was 32% on day 1. No reading for day 3. And white blood cell count, 10.2 on day 1. On day 3, it's 13.8. Potassium of 3.3 on day 1. 3.1 on day 3. Sodium level on day 1 was 137. And the carcinoembryonic antigen is 9.1 nanograms per ml on day 1. Creatinine level was tested on day 3, and the result is 1.3 milligrams per deciliter. And his fecal occult blood test was positive, and this was done at the bedside. Now, on day 3, they retested the patient, but this was more of laboratory based. It read negative. Let's move on into the task for you to complete this item. It said highlight the specific findings in the nurse's progress notes from day 3, 8 a.m. that require immediate follow-up by the nurse due to potential post-op complications. So here's the documentation. It stated, patient reports increased loose stools, 5 episodes overnight, intermittent dizziness when standing, mild nausea, vital signs, blood pressure 132/84, heart rate 102 beats per minute, respirations 20 per minute, temperature 38.1, oxygen saturation 95, skin warm, slightly diaphoretic, pain scores 3 out of 10, surgical site clean, no erythema, oncology consult pending for adjuvant chemotherapy. Patient was educated on clear liquid diet initiation. Now, I want you to pay close attention to the phrases here and go back to the instruction. So do not get distracted with the other words and phrases that is not relevant to the case. Let's get started answering this question. Now, one of the phrases that you should pick here is the increased loose stools, that's 5 stools or 5 episodes overnight, because this is not just a typical gastrointestinal upset. This might be a sign of something serious like a leak in the anastomosis, and that's when the surgical connection between the bowel segments starts leaking, which can lead to peritonitis and even sepsis. So we need to catch this. Another phrase that you should highlight is intermittent dizziness when standing. That's very significant because this could point to maybe dehydration or low blood volume, possibly from frequent diarrhea. But we also have to think bigger here. This might be an early sign of systemic compromise, could be progressing sepsis. And looking into the vital signs here, we're going to highlight heart rate of 102 beats per minute. Anything that's higher than 100 That's already tachycardia. And looking into the patient's temperature, 38.1 degrees centigrade, this may seem mild at first glance, but when you look into these two, these suggest that the body is fighting off something, likely an infection or inflammation, and possibly tied to that suspected leak. Another assessment finding that you should highlight is this: skin warm, slightly diaphoretic. This often means the body is under stress, maybe from infection or inflammation, and it's trying to compensate. And this one also goes hand in hand with the other signs pointing toward systemic infection. Now, the rest of the phrases here and words are not going to be highlighted here. For example, mild nausea, that's on the third line here. This one is not ideal, but it's pretty common after any surgical procedure, especially when patients receive opioids like hydromorphone. And it's not something to ignore, but also not the top concern right now. If you highlighted the pain level of 3 out of 10, this tells us that the pain is well managed and nothing about it really suggests something is going on, or especially with the surgical site or internal healing. Now, if you highlighted surgical site clean, there's no redness, that's actually a good sign. It makes a local wound infection less likely, which is going to help us focus on possible internal issues instead. Now, for the rest of the vital signs, we have blood pressure of 132/84, respirations of 20, saturation of 95. These are within the acceptable range, so these do not really point to any urgent issue. And for the oncology consult pending and clear liquid diet modification or initiation, these are part of the normal post-op care process, and these two do not point any immediate complications, so you got to eliminate those as well. So I want you to pause here and reflect your answers and compare it with the rationales that I have provided for you. And when you're ready, let's go right into the next scenario. It says here, on post-operative day 3, the patient transitions to a clear liquid diet. Pathology confirms stage 3B colon cancer with 6 positive lymph nodes. The patient exhibits persistent fatigue, frequent loose stools, and a low-grade fever, raising concerns for post-operative complications. The oncology team plans adjuvant chemotherapy with oxaliplatin and capecitabine to start in 3 weeks. And in the progress notes, I'm not going to reread this since we have already scanned this, but feel free to refamiliarize yourself with the data. And we have the same laboratory results for day 1 and day 3. Also scan this if you need to. Now, the task here is to select the most likely options for the statement. And here it goes. Based on the patient's day 3 findings of fever, loose stools, dizziness, and elevated white blood cells, the nurse hypothesizes the patient is most likely experiencing blank, which increases the risk for blank. And here are the options for the first blank: chemotherapy-induced neutropenia, anastomotic leak, hypovolemic shock, surgical site infection, bowel obstruction. For the second blank, the options are peripheral neuropathy, sepsis, cardiac dysrhythmias, tumor lysis syndrome. Let's fill in the blanks here. So for the first blank, the correct answer is anastomotic leak, because by post-op day 3, the patient is showing several red flags. This patient developed mild fever. There's also lots of loose stools overnight. He experienced dizziness, has leukocytosis at about 13,000, right? And that's quite significant. And when you put all these together, these strongly point to an anastomotic leak, which is when the surgical connection between the two bowel segments starts leaking. And this can spill intestinal contents into the abdominal cavity. And noticing about the diarrhea, this could be a sign of bowel irritation, leakage, and the fever plus the leukocytosis suggests an infection or inflammation that is brewing, and the dizziness might be related to dehydration or early signs of systemic compromise. The second blank's answer would be sepsis. If the anastomotic leak is not caught and it's not treated early, it can cause peritonitis, and it can quickly spiral into sepsis, which is a more serious body-wide infection. And in this patient, early signs like the fever, the tachycardia, the diaphoresis are classic signs of systemic inflammatory response. And so if we don't act quickly, then it could become very life-threatening. Now, if you selected chemotherapy-induced neutropenia for the first blank, it's not likely because the patient has not even started chemo yet. It's stated in the scenario that the patient is scheduled to start taking the chemo in 3 weeks. Now, another reason why this is not going to be the answer is because neutropenia should have low white blood cell count, not elevated as we are seeing in the patient's lab results. Patient has 13.8 in the white blood cells. So this is not really jiving here. So eliminate chemotherapy-induced neutropenia. If you selected hypovolemic shock, yes, maybe, because of the dizziness and the tachycardia, it could suggest some fluid volume loss, but the blood pressure that the patient, especially if we're referring to that 132/84, it's actually holding steady. There's no indication of heavy fluid loss like major bleeding or massive diarrhea yet. So this is not really the top concern. Now, if you selected surgical site infection or SSI, well, when you go back into the data, the incision looks good. There's no redness, no drainage, no swelling. And when you think about true surgical site infection, it usually shows up with localized symptoms. But here, we are seeing systemic symptoms. There's fever, diarrhea, which point away from a superficial wound problem. Now, if you selected bowel obstruction, this one doesn't fit either because the patient has loose stools and hypoactive bowel sounds. Now, if you think about true obstruction, it usually causes the exact opposite. No stools, vomiting, severe abdominal distension. Also, the prior obstruction was already treated with surgery. Now, let's look into the other options that are incorrect for the second blank. If you selected peripheral neuropathy, well, this is a common side effect of chemo drugs like oxaliplatin, but since the chemo has not even started yet, then neuropathy is not relevant in this case. For cardiac dysrhythmias, which is also incorrect, well, there's no sign of heart rhythm problems. We don't have any information about ECG issues, no irregular pulses, plus the cardiac issues are not directly linked to an anastomotic leak. Lastly, we have tumor lysis syndrome. This is something that you expect after chemotherapy and mostly with blood cancers like leukemia. But since the patient has not started the chemo and does not have high risk tumor type, then you're going to eliminate TLS in this case. I want you to pause here and reflect on your answers and compare it with the rationales that I have given to you. Let's move on to our next scenario.
Before moving ahead, here's something you need to hear. If you're feeling anxious about passing the NCLEX, especially if you're aiming to do it in 1 week or 1 month, then our complete online NCLEX review crash course is your answer. This is your shortcut to success, a tried and tested course with a 99% passing rate. More than 5,000 students have achieved their NCLEX goals using this course, and now it's your turn. Here's what's included. 100-hour animated mini crash course, perfect for for last-minute preparation to pass in just 1 week. 300-hour comprehensive lectures covering 300 high-yield topics that the NCLEX loves to test. 5,000 real NCLEX questions. Train with real exam-style questions and be prepared for anything. 15 full-length practice tests, including CAT simulation. Build your confidence with realistic exam experiences. Exclusive NCLEX ebook and 1-year access. Study whenever you need without restrictions. Don't let this opportunity slip away. Enroll now at 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. Now, let's jump into the topic.
Test item number 3. It said, on postoperative day 3, the patient transitions to a clear liquid diet. Pathology confirms stage 3B colon cancer with 6 positive lymph nodes. The patient exhibits persistent fatigue, frequent loose stools, and a low-grade fever, raising concerns for postoperative complications. The oncology team plans adjuvant chemotherapy with oxaliplatin and capecitabine to start in 3 weeks. Now, it looks like we have already scanned the nurse's practice notes. This is not a brand new nurse's notes. The same thing with the lab results. So feel free to pause the video and review this before you jump into the test question. Now, this is your task. You're going to complete the sentence. We have the phrase. It said, to address a suspected anastomotic leak, the nurse should blank, blank, and blank to prevent further complications. Now, don't worry. We got so many word choices here. One of the options is monitor oxygen saturation continuously, prepare for a possible exploratory laparotomy, increase IV fluid rate to 200 mL per hour, obtain an order for abdominal imaging, administer oral antidiarrheals, and notify the surgeon immediately. So I want you to prioritize your interventions here, especially that you are worried about the suspected anastomotic leak. So what should come first? The answer for the first blank should be notify the surgeon immediately. When you suspect the anastomotic leak, this is a medical emergency because we know that it can quickly lead to peritonitis and sepsis, which are both life-threatening. And if we let the surgeon know immediately, this is going to help the patient get evaluated as soon as possible, and they get treated as fast as possible. So we're actually, it means that we are going to return this patient to the OR immediately for a possible surgical repair. After that, you're going to select this one. Obtain an order for abdominal imaging. This could be in the form of a CAT scan of the abdomen with contrast. This is the best way to confirm if there is a leak, because it will show if the contrast dye is leaking out of the bowel or if there is free air or fluid in the abdomen. And so the imaging will help the team decide what to do next. Now, the next intervention is to prepare for a possible exploratory laparotomy. Because if the imaging confirms serious leak, the patient might need to go back to surgery immediately. So this involves fixing the leak or maybe surgically cleaning out the abdominal cavity or even creating a temporary colostomy. So it means getting things ready ahead of time makes everything move faster and safer for this patient. So the rest of the options are incorrect. If you selected to administer oral antidiarrheals, this is not safe, especially when you suspected the leak is going on. And loperamide can slow the bowels down, the peristalsis, which might hide important symptoms, and this will make the situation even worse by holding those infected contents in the abdomen longer. So you got to avoid this one. If you selected to increase IV fluid rate to 200 mL per hour, yes, this is possible. The patient might be a little dehydrated based on the symptom. He complained about the dizziness, but that's not the first priority here. Right now, confirming the leak and getting the surgical help will take priority here, because and also that fluids can be adjusted once the main issue is addressed. So this is not really the main priority here. We don't have any issue of hypotension right now. Next, if you selected to monitor oxygen saturation continuously, well, this might be a good intervention, but our patient is stable. He is saturating at 95%, and there are no signs of respiratory issues. And we know that this is really important, especially monitoring vitals, but oxygenation is not the main concern at the moment. So your focus needs to be on getting the diagnosis confirmed and make sure that we are involving the surgical team really quickly this time. Let's proceed to the next test item.
Before we move ahead, here's something you shouldn't miss. If your goal is to pass the NCLEX in just 1 week or 1 month, then the fastest and most effective way is to enroll in our complete online NCLEX review crash course. This course is a one-stop solution, a reliable shortcut, and a proven method with a solid 99% passing rate. More than 5,000 students have successfully passed the NCLEX by using this course. Here's exactly what you'll get. 100-hour mini crash course perfect for those who want to pass within a week. 300-hour comprehensive lectures covering 300 essential NCLEX topics that are commonly tested. 5,000 real NCLEX questions. Prepare with real exam questions and eliminate surprises. 15 full practice tests, including CAT simulations, simulate the real exam for a stress-free experience. Exclusive ebook plus 1-year access. Study whenever and wherever you want. Seats are filling up quickly. Enroll now to save 70%. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. Now, let's continue with the topic.
It says, the oncology team has planned adjuvant chemotherapy with oxaliplatin and capecitabine to start in 3 weeks to address the advanced stage of the cancer, given the pathology findings of 6 positive lymph nodes. As part of anticipatory care, the nurse is preparing to educate the patient and implement strategies to manage potential chemotherapy-related toxicities. Now, your task, it says here, for each nursing action, select whether it is a priority intervention, appropriate but not priority, or contraindicated for managing oxaliplatin-induced complications. Here's the matrix. So pay attention to the nursing actions here. You have about 6 of them, and you're going to select whether it's priority intervention or appropriate but not priority, or if it is contraindicated. So let's pay attention to the first one here. It says, assess for difficulty swallowing or throat discomfort during infusions. What do you think about this one? Well, the correct answer here is priority intervention, because sometimes patients who are receiving oxaliplatin can suddenly feel like their throat is getting so tight, or that they cannot swallow well. This is what we call as laryngopharyngeal dysesthesia. This is not very common, but it can be very scary and can feel like they're losing their airway. And that's why it's really important to assess them right away if they mention these symptoms during the infusion. So you might need to slow the infusion or even stop it briefly. And so the goal is to catch this early and keep the patient safe and comfortable. Let's move on to the next nursing action. It says, educate the patient on using protective footwear to prevent injury. The answer is priority intervention, because patients taking this medication will eventually develop neuropathy, wherein they will not be able to feel their feet very well, so they might not notice small cuts, even scrapes or blisters, which can get easily infected, especially if their immune system is already suppressed from the chemo. So we always want to educate them to wear protective shoes, nothing open-toed or barefoot at home. So implement to document or to educate about good footwear to prevent any injuries that they might not feel and keeps them from developing those infections. Now let's move on to the next nursing action. It says recommend low impact exercise like walking to maintain mobility. Now this is categorized as appropriate but not priority. So this is pertaining to those gentle activities like walking, because these are great. They can help with the circulation, the patient's mobility, and this can maintain their strength, and they don't worsen neuropathy symptoms as well. So this is definitely something we want to encourage, but it's not as high on the list as things like safety assessments or patient education to prevent injury or manage urgent symptoms. So we'll keep it there. Now let's move on to the next action. It says monitor for muscle cramps or spasms in extremities. The answer to this one is appropriate but not priority, because some patients with long-term neuropathy might start having muscle cramps or spasms in their hands or feet, and it's not usually urgent, but it's still important to keep an eye on it because it could mean the neuropathy is getting worse. So you got to document this one and report it as needed. It may lead to adjustments in their care plan as well. Let's move on to the next one. It says administer gabapentin as prescribed for neuropathic pain. This is also appropriate but not priority. Now I want you to recall that gabapentin is commonly prescribed if the patient has neuropathic pain, which is affecting their quality of life. This is a medication that will help calm their nerve signals, but we usually administer this or will teach the patient in using this drug after we have tried to prevent or minimize the symptoms first. So this intervention is helpful, but more of a supportive measure than a top priority. And lastly, we have encourage high impact aerobic exercises to improve nerve function. This one is contraindicated. Why is that? Well, as we are talking about high impact aerobic exercises, so we are talking about activities like running or jumping, which are not safe for patients with neuropathy because they might not feel the ground very well and their balance can be off, which puts them at risk for falls, maybe injuries, so they might not even notice right away. So instead, we're going to recommend low impact exercises like walking, swimming, or yoga, which are safer and will help with their overall health and their mobility. So here, I want you to pause for a minute and reflect on your answers, compare it with the rationals. Now, let's move on to our next test item.
Before moving ahead, I have some exciting news for you. If you are determined to pass the NCLEX within a week or a month, then your best option is to enroll in our complete online NCLEX review crash course right now. This course is a comprehensive all-in-one solution, a guaranteed shortcut, and a proven method to pass. Over the last 5 years, more than 5,000 students have successfully cleared their NCLEX exams using this course with an impressive 99% passing rate. Here's what you'll get: 100-hour animated mini crash course, ideal for those who have limited time and want to pass in just 1 week. 300-hour comprehensive recorded lectures covering 300 high-yield NCLEX topics that the exam loves to test. 5,000 real NCLEX questions, practice with actual past exam questions for better preparation. 15 full-length practice tests, including CAT simulation. Feel confident before your real exam day. Exclusive NCLEX ebook, the ultimate guide you need to pass. 1 year full access. Study anytime, anywhere at your own pace. This is a limited time offer. Enroll now to grab 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. All right, now let's dive into the topic.
Number 5, we have a bow tie. It says, the nurse educates the patient on managing the adverse effects of oxaliplatin and capecitabine. Your task here is to complete the diagram by dragging from the choices to specify the primary adverse drug effect, 2 teaching points, and 2 statements indicating understanding. So we have the options here for the primary adverse drug effects. It includes nephrotoxicity, cardiotoxicity, hepatotoxicity, bone marrow suppression, peripheral neuropathy. I want you to recall whatever you know about this anti-neoplastic medication. So let's start filling the blanks or boxes. The answer for the primary adverse effect is peripheral neuropathy. Now let's talk about this one. This is very important. We have already mentioned about the peripheral neuropathy in the previous test item. Now, peripheral neuropathy is the hallmark side effect, or adverse effect, I should say, of this chemotherapeutic agent, especially for patients being treated for colorectal cancer. And what's unique here is that the neuropathy can happen right after the infusion and is often triggered by cold. So think about cold drinks, cold air, or even touching a freezer door. And here, patients typically feel numbness. They're going to have tingling or burning in their fingers and toes. And over time, it can become more serious. Even it can interfere with their walking or doing fine motor tasks like buttoning a shirt. So before treatment even starts, it's key for us to prepare the patient to avoid cold exposure and to recognize early symptoms and to make sure that they report these manifestations as soon as possible. The reason why we have to include those teaching, it's because there's about 80 to 90% of patients who will experience some level of neuropathy, and we want to make sure that we are able to intervene to prevent long-term complications. Now, let's talk about the other options here. If you selected bone marrow suppression, yes, this is a possibility, but it's not as common or dose limiting as the neuropathy, so we are eliminating this one. For hepatotoxicity, this is not a big concern here. With mild liver enzyme bumps, it can happen with the other drug, the capecitabine, but liver toxicity is not a major issue with oxaliplatin. Now, talking about cardiotoxicity, this is more of a concern with doxorubicin, but not oxaliplatin. So you eliminate this one as well. If you selected nephrotoxicity, well, unlike cisplatin, the medication the patient is supposed to be given, which is the oxaliplatin, is much more gentle on the kidneys. So again, this is not the main concern here. Let's move on into the two teaching points. The options are take antidiarrheal medications as prescribed, discuss dose reduction with oncologist if symptoms worsen, report numbness or tingling in extremities, monitor for signs of infection, report persistent nausea to the provider, avoid handling cold objects without gloves. So the two answers for the two boxes here, we have avoid handling cold objects without gloves. We know that cold can trigger neuropathy and the symptoms can happen instantly. So here's a tip for you. You need to educate the patient to use gloves when touching any cold objects. Could be items from the fridge or the handle on the refrigerator or even during winter time. So make sure that they know about this. Now, the other intervention or teaching point, I should say, is report numbness or tingling in the extremities. So the earlier they let the care team know, the much better, because this is going to allow those medication adjustments or maybe some other interventions like to help them manage the symptoms. That's why we're going to keep this one. Now, for the statements indicating understanding, we have the options. I'll increase my fluid intake if I have diarrhea, or I'll check my temperature daily. I'll avoid spicy foods to prevent nausea. I'll use heating pads for tingling. I'll call my doctor if I notice tingling in my hands. And lastly, I'll wear gloves when reaching into the freezer. Well, the correct answers here are the following. One of those is I'll wear gloves when reaching into the freezer. This shows that they've learned about the cold sensitivity and know how to prevent the symptoms. The other one is I'll call my doctor if I notice tingling in my hands. This is perfect. That shows they understood the importance of early symptom reporting. Now, let's talk about the other options here. If they stated, I'll use heating pads for tingling, well, this is not recommended because heat may irritate the nerves further. Or if you selected, I'll avoid spicy food to prevent nausea, well, this is related to the other medication, capecitabine, not neuropathy. If you selected, I'll check my temperature daily, well, this is something helpful if you are watching the patient for any infection, but it's not relevant to neuropathy, so you got to eliminate this one. Or if you selected, I'll drink more fluids if I get diarrhea. Again, diarrhea is the adverse reaction of capecitabine, so it doesn't fit here. Now, my tip for you as a nurse in this clinical scenario, your role is to help the patient understand not just what to watch for, but also why it matters. And remember that oxaliplatin-induced neuropathy can affect their quality of life, and it can also affect the continuation of the medication and even basic tests. So you gotta keep teaching the patient, make sure that your instructions are clear, it's focused, and something that's actionable, and this can make a real difference for the outcomes in your intervention. Lastly, we have our sixth item.
Before moving ahead, I have some exciting news for you. If you are determined to pass the NCLEX within a week or a month, then your best option is to enroll in our complete online NCLEX review crash course right now. This course is a comprehensive all-in-one solution, a guaranteed shortcut, and a proven method to pass. Over the last 5 years, more than 5,000 students have successfully cleared their NCLEX exams using this course with an impressive 99% passing rate. Here's what you'll get: 100-hour animated mini crash course, ideal for those who have limited time and want to pass in just 1 week. 300-hour comprehensive recorded lectures covering 300 high-yield NCLEX topics that the exam loves to test. 5,000 real NCLEX questions, practice with actual past exam questions for better preparation. 15 full-length practice tests, including CAT simulation. Feel confident before your real exam day. Exclusive NCLEX ebook, the ultimate guide you need to pass. 1 year full access. Study anytime, anywhere at your own pace. This is a limited time offer. Enroll now to grab 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. All right, now let's dive into the topic.
It says here the patient is receiving adjuvant chemotherapy with oxaliplatin and capecitabine. The nurse evaluates the effectiveness of interventions for chemotherapy-induced neutropenia to optimize patient outcomes. So go back into the clinical scenario here. We have a trend of the patient's absolute neutrophil count, the temperature, symptoms reported, and the interventions. So let's go through each week here. It says in week 1, the patient's absolute neutrophil count was 1,100 per microliter. Temperature is 37.4. Patient reported fatigue, mild sore throat, nasal congestion, filgrastim started, hand washing taught. On week 2, the absolute neutrophil count was 1,300 per microliter. Temperature 37.8. Now reported persistent sore throat, reduced nasal congestion, mild fatigue. And around that week, filgrastim continued. Patient avoids crowds. Oral hygiene emphasized. For week 3, the ANC level was 1,700 per microliter. Temperature 37.1. No sore throat, occasional fatigue, improved appetite, and filgrastim continued. Patient uses electric razor, reports good hand washing. For week 4, the ANC is 1,600 per microliter, 37.2 for temperature, no sore throat, minimal fatigue, new mild cough, and filgrastim dose adjusted. Patient educated on mask wearing. So the task for you to do is to select all findings in the flow sheet that indicate the interventions for chemotherapy-induced neutropenia have been effective. Now, for each finding, you're going to mark effective if it demonstrates the success of interventions, or not effective if it does not. So here is the matrix. Now, let's take a look each row. We have week 3. It says absolute neutrophil count of 1,700 per microliter. This is effective because by week 3, the ANC has increased to 1,700, which is finally within the normal range, right? We have 1,500 to 8,000 per microliter. So this is a good sign that filgrastim is doing its job. It's helping the bone marrow to produce more neutrophils. And with more neutrophils on board, the patient's risk for infection drops. Now let's pay attention to week 3. We are talking about temperature right now, which is 37.1 degrees Celsius. This is effective because the patient's temperature dropped from 37.8 in week 2 to 37.1, which is much closer to normal. And this tells us that whatever low-grade infection or inflammation might have been going on, this is likely resolving. And it also suggests that the neutrophil boost from the filgrastim, along with infection precautions, is working. Let's look into week 3. No sore throat. This is also effective because the sore throat that was present in the first week or the first 2 weeks is gone right now. And that's another positive sign, possibly showing that any previous infection has cleared up. And this also lines up with the improvement of the absolute neutrophil count and also shows that infection prevention strategies like good hygiene are helping. Let's look into week 3, occasional fatigue. What do you think about this one? Well, obviously not effective. We know that fatigue is less frequent now, but it's still there. And fatigue is very common in cancer patients. And this can be due to so many things like chemotherapy or anemia. And it does not necessarily reflect how well the neutrophil count is recovering. So we can't really use this as a sign of treatment success. All right, let's have week 3, improved appetite. This is also not effective. Well, it's great that the patient is eating better, but this is not something we'll link directly to absolute neutrophil count or infection risk. And take note that appetite changes are more about overall recovery or maybe less nausea. This is not a measure of how effective filgrastim is, so we are categorizing this one as not effective. Let's shift into week 4, ANC of 1,600 per microliter. Obviously, not effective. We know that ANC is still in the normal range, but it dipped slightly from 1,700 to 1,600 per microliter. So this small drop could mean that the effect of filgrastim is leveling off or tapering down. And since we are not seeing any continued improvement, this is not considered fully effective. Now for temperature, 37.2 for week 4, this is not effective, although the temperature is still technically normal. It's a little higher than last week and not a clear sign of continued improvement. Plus, we know that the patient has a new symptom, which is a mild cough, right? Go back into the flow sheet, and this also raises a red flag. Now let's look into week 4, no sore throat. This is effective. This is a good sign that there's no sore throat. The absence of symptoms like this can help confirm that infection control measures are holding up and there's no active infection in that area. All right, week 4, minimal fatigue. This is going to be not effective. Even though fatigue has improved a bit more, it's still not a reliable way to measure how well neutropenia is being managed. Again, fatigue is just too non-specific here. And lastly, on week 4, new mild cough. This is also not effective because A new cough could mean a possible infection starting, or even just an unrelated respiratory issue. But either way, it's a new symptom that gives us pause rather than showing that things are continuing to get better. So I want you to go back into the symptoms being reported and the interventions to make sure that you understood the key signs, whether the patient is improving or not. So let's look into what we've learned so far. For the test item number 1, that was a hotspot. So here you practiced sharpening your clinical judgment by focusing on the key post-op signs like the frequent diarrhea, fever, and the tachycardia weren't just routine findings. They were early red flags for serious issues like the anastomotic leak. So when you are recognizing those signs, it's going to help you guide your next clinical decisions. For test item number 2, that was the drop-down type. So here you prioritize hypothesis, and you also strengthen your ability to connect the dots between symptoms. And when you observe that the patient is having fever, diarrhea, and elevated white blood cell count, then you correctly considered the possible anastomotic leak that could have led to sepsis. So this one also helped you rule out those less urgent problems like localized wound infection. For test item 3, that was a drag and drop. You were generating solutions there, and when you notice that complications such as the anastomotic leak, you knew what to do. You have focused on what's most important action, such as notifying the surgeon or obtaining an order for diagnostic imaging. So the issue could be caught early and managed before it worsened. For test item number 4, that was about a matrix multiple response. You took action there. So in that test item, you effectively prioritized managing oxaliplatin-induced peripheral neuropathy by assessing for throat discomfort during infusions and educating patients on protective footwear to prevent injuries and avoiding contraindicated actions like high-impact exercises that could exacerbate the symptoms as well. Now, for test item number 5, that was a bow tie. So you took action as well. So you used the patient education to prevent the complications by teaching the patient to stay away from cold and to report numbness or tingling early, so to prevent mild symptoms from turning into something more serious. And lastly, you tackled test item number 6. That was a matrix multiple choice. You evaluated outcomes. So here you improved your ability to assess whether interventions were working, and you looked into the lab trends such as the absolute neutrophil count. You also looked into the patient's temperature and tracked their symptoms, and you were able to determine whether the patient was truly improving rather than reacting to the isolated signs. So that's all for today. If you find this video helpful, don't forget to subscribe to the YouTube channel for more NCLEX prep, and give this video a thumbs up and share it with your friends who are also preparing for the NCLEX. I'll see you in the next review session. Thanks for watching.